A little bit about the psychological aspect of all this. I'm joined now by Dr. Danny Brom. He's the founding director of Metiv, the Israel Psychotrauma Center, and he's joining us from Tel Aviv. Dan, are you there?
Hi, I'm here from Jerusalem.
Oh, from Jerusalem. Great. Thank you so much, Doctor. If I may ask you, are you involved at all with in an official capacity with this, or no?
No, we're not officially, let's say, invited to deal with either the children or the adults. That is the ministries that are doing that. But we, in general, see people some weeks after, and we have seen quite some people from either the festival that was there or from the places down south, or people reacting. We've had an enormous amount of people asking for help because of previous traumas or having been in the army and not having been able to cope with everything that they've been seeing.
Great. Doctor, if I may, Doctor, we have never, in Israel, they've never had to deal with any of this. In fact, from what we understand, they've had to create some special protocols. I can't think of any. I know in America, what we in America do, especially when there's a school shooting, a lot of they bring in counselors, crisis counselors, to help some of the kids deal with the shootings that occur in their schools. Israel has never had anything like this at any scale like this. So when the hostages are being released, where do you even begin?
So I think we have to begin with understanding that they need a medical assessment. But in terms of the psychological reactions, we have to prepare ourselves for allowing them to heal. And that happens mostly by itself, by being in your warm environment, by people not pressuring them either to speak or to not speak, but to have them, give them the space they need in order to process what they've been going through.
But does that mean to recount, or not necessarily? Like, I wonder, how does one heal from something like this? Where do you like if something like this happens in trauma? That I know there's some schools of psychology that say that you should recount. Is this what should happen here?
Mostly that will happen by itself. When people feel safe, the memories will come up and then need to be processed. That means that if you have someone you really trust, you'll be able to speak. And that happens in a very natural process, which is basically a pendulum between trying to not speak and trying to avoid it. And on the other hand, it comes up by itself, either in dreams or in spontaneous memories coming up. The fact that these will come up is a sign of health, is a sign that people start to feel safe enough to let that happen. And that is a process that takes months, sometimes years, certainly if they've also lost, and if we're talking about a process of grieving a parent or grieving a child, these are long-term processes.
Yeah, and that brings up a question, Doctor, if I may, that so many people are saying that these 200 plus people, whether they're adults, children, maybe even some of the babies, I mean, they're going to be so traumatized, they're in their head, they're gone. Should we prepare for that?
No, that is, I can answer very simple, give you a simple answer on that. No, that is not true. People are not gone. I've worked with Holocaust survivors. I've worked with people who've been terribly traumatized, either in severe sadistic sexual abuse or other forms of trauma that are as severe as this. And no, people are not gone. People can cope with a lot of horrible stuff, and that causes a lot of trouble, but it is not necessarily psychopathology. So we have to be careful not to make this into a talk about psychopathology and people being broken and things like that. People have to rebuild their trust in other people, because that is what you need when you are in severe distress. You need someone else to be able to trust and cry and feel guilty and feel anger and feel afraid, and then start again to go out to the world and try it out again and see that it doesn't happen again. That is, of course, one of the main issues. How can we be sure that this doesn't happen again?
Great.
That is not pathology, that is health.
Dr. Danny Brom, thank you very much for that very hopeful ending note there, that there's hope out of all of this. Dr. Danny Brom joining us from Jerusalem, the founding director of Metiv, the Israel Psychotrauma Center. Thanks again.